Wrestling with chronic back or sciatic pain? Stick around because we're going to do two tests today to determine why you're having back and or sciatic pain. Before you can fix your back or sciatic pain, you have to understand why you're having it in the first place. The two tests I'm going to show you today typically aren't done in most clinics. Why? This is because we're trained in medicine to focus on tissues that are damaged, what I call a component approach to solving pain. And this works well for acute problems, but for chronic problems, it doesn't work so well, which is why you're probably watching me now. The two tests I'm going to show you today are based on understanding your body as a system, how things work from head to toe, and seeing that all at once. They're simple, they're fast, and you don't need a lot of technology to do them. So let's get started. The first test is basically lying down on your back with your legs straight for about 30 seconds. Do you like this position? Or does your back not like this position? And then after about 30 seconds, you're going to bend your knees so your feet are flat on the ground, or you can hug your knees to your chest if that feels better for you. Again, hold this for about 30 seconds. Okay, so one of these two positions should make a difference for your back pain. One should likely make it feel worse, and the other should make it feel better. What I have found in 99% of most chronic back pain problems is that most people feel better when their knees are bent. Their feet are flat on the ground, or they're hugging their knees to their chest. So what's going on here? Basically, if your back felt better when your knees were bent, or with your knees hugged to your chest, then you're dealing with something called an extension problem, which just means that your back has too much arching occurring in the low back area, or there are too many forces trying to pull it into an arch. Arching of the back means extending it, and so this is why we call it an extension problem. All you have to do is extend your back less. So extension problems, like I mentioned, are common with chronic back pain issues. If your back felt better with your legs straight rather than with your knees bent, it means you have the opposite of that. You have what I call a flexion problem. That means that your spine is too flat and it likes to have more of an arch in it. And if you do that test again with your legs straight, you'll notice that there is more space underneath your low back than when your knees are bent. It's simple as this. Your back is telling you that it wants more arching in your back. And again, if you have an extension problem, your back is telling you, hey, I need less arching in my back. How can you use this information? Well, simply, you might notice that your back starts to get achy throughout the day. Just stop and notice whether your back is arching or whether it's slouching or flat during those circumstances. If you have a flexion problem where your spine wants more arching, then chances are when you notice that you're having pain, it's because you're slumping in your back too much or you're bending forward too much. And if you have an extension problem where your back has too much arch, you'll notice that your back feels better if you will allow your back to slump a little bit more, that you've been holding it too rigidly arched this whole time. All right, so what's the second test? Well, the second test is basically taking off your shirt and having someone take a picture of your back. And you'll see in these images here that there's a larger crease on one side of the waist than the other. Look closely at these. So if you have a larger crease on one side of your waist than you do on the other, chances are that's the side where you're experiencing pain. So what's going on here? Why are we having a crease on one side of the waist rather than the other? Well, this is what I call a side bending problem. It means that that side of the pelvis is typically higher, and also the rib cage is typically lower on that side, which creates a crease. And you can imagine that if this is happening, that it is increasing compression on this side of the spine. Well, the sciatic nerve roots exit from this side of the spine and pelvis, and so this side bending problem is often one of the patterns that's causing sciatica or one-sided back pain problems. Why is the side bending problem happening? Well, there are many, many reasons why this could be happening, but typically it boils down to there is some older injury you have that you've been compensating for, and that your brain has become accustomed to compensating by creating the side bending problem to get off of that injury. So ultimately, to solve your sciatic pain, we have to understand what that injury is. And typically it's an older, forgotten injury that you thought, oh, doesn't cause any pain anymore, so therefore it must be better. Well, actually no. The reason it's likely not causing pain anymore is because you've been compensating around it to unload it, which is now leading to this pattern that's now causing your one-sided back pain or your one-sided sciatic pain. So what do you do with this information? Well, first of all, understand that these patterns can be fixed, and they're usually due to how you're using your body. And how you're using your body is usually relating to some older problems that your brain has compensated around. So I've recently written a book called Pain Patterns, Why You're in Pain and How to Stop It. And I've made a series of YouTube videos for each chapter of that book, which will take you through these and more tests to help you determine why you're having pain. They're free, and it starts with this video here. I would encourage you to watch all of those videos. They're only about 5 minutes long each, but they'll take you through several tests to help you dig down deeper into why you're having pain. This is the key. Before you can do any stretches or strengthening exercises, you have to understand where the problems are first. And if you have chronic pain, the reason other practitioners haven't found your problems is because of their component thinking approach, trying to understand which tissues are irritated and solving those, rather than understanding how the whole system is operating together to create your pain. I strongly encourage you to do that. Now, if you have questions about your pain and you would like me to make a little video for it, I'm happy to do that. So put your issues in the comment section below and I'll try to get to it and make a video for it. I've done that for other people. I'm happy to do it for you as well. Otherwise, I think the next best step would be to purchase my Pain Patterns book, and there's a link below on Amazon, to get a better idea of what I'm talking about with this systems thinking approach. It's completely different than how you've likely been approached so far. And I really believe that you will find the answers you're looking for in the simple tests and exercises that I have in this book. Again, first you have to test before you start doing anything to understand what the problems are that you're trying to solve.